Hi, my name is Christina Fasulo, and I'm a GI dietitian at Cedars-Sinai Medical Center. Thank you for inviting me to present at IBD Journal Club Nutrition Corner, April 2021. The research article I'm presenting was published in Clinical Gastroenterology and Hepatology in 2020 and is titled Low-Fat, High-Fiber Diet Reduces Markers of Inflammation and Dysbiosis and Improves Quality of Life in Patients with Ulcerative Colitis. Due to various side effects and costs, combined with the possibility of treatment failure with available medications, many patients with IBD search for relief outside of conventional medicine, including non-pharmacologic agents such as dietary therapy. It's estimated that 80 to 90% of patients want their physicians to provide dietary advice. So what do we know about diet for IBD? Research has shown diets high in fat and animal meat are associated with an increased risk of Crohn's disease and UC. Other studies have shown that diets rich in certain saturated fats, such as myristic acid, are associated with a higher risk of flaring in UC patients. Now, with Crohn's patients, association studies have found that consumption of vegetables, fruits, fish, and dietary fiber decrease the risk of Crohn's disease, but thus far, diet studies have not yet yielded meaningful results for patients with ulcerative colitis who want to enhance their quality of life and/or minimize flares. Therefore, the aim of this paper was to study the effects of a low-fat, high-fiber diet versus an improved standard American diet. Inclusion criteria include a disease history of at least 3 months, a confirmed UC diagnosis by colonoscopy within 2 years before randomization, and a moderate to low partial Mayo score of less than 7 with a flare in the past 18 months. Participants were randomized into 2 groups and received a catered low-fat diet or improved standard American diet intervention for a 4-week period, followed by a 2-week washout, and then switch to the alternate diet for 4 weeks. All meals were prepared and delivered by a caterer, with diet calories tailored to meet the individual's needs. Stool studies, lab samples, and surveys were completed at baseline and at the end of each diet intervention. Primary outcome was quality of life. Secondary outcomes included changes to partial Mayo score, inflammatory markers, microbiome, and metabolome, as well as adherence to a catered diet. Here you can see a comparison between the 3 diets. Of note, the improved standard American diet and the baseline diet or standard American diet are very similar in total calories from fat, as well as saturated versus unsaturated fat percentages. In comparison, both the low-fat diet and the improved standard American diet are lower in percent sugar and higher in grams of fiber. What do they find? First and foremost, all patients remain in remission throughout the study period. Now, compared with baseline, improved standard American diet, and the low-fat diet, each increased quality of life based on short-form IBD questionnaire and the short-form 36 health survey scores. For markers of inflammation, CRP decreased, which was insignificant after a low-fat diet. However, serum amyloid A decreased significantly on the low-fat diet. For fecal markers of intestinal dysbiosis, actinobacteria decreased significantly, whereas the relative abundance of Bacteroidetes increased, and both of those were after the low-fat diet. Fecal levels of acetate, an anti-inflammatory metabolite, and tryptophan increased significantly on the low-fat diet, whereas fecal levels of lauric acid decreased significantly. The main limitations of this study were the length of the intervention, the small sample size, and enrolling patients with minimal symptoms, which made it difficult to draw overarching conclusions about the efficacy of these diets. Bacteroidetes increased and actinobacteria decreased after a low-fat diet, which did suggest an improvement in dysbiosis. Along with that, the low-fat diet did increase Faecalibacterium prausnitzii, which may be beneficial in the context of IBD. Most importantly, patients' quality of life improved on both diets, and neither diet exacerbated symptoms, which is notable given the higher fiber content in both of these diets. Baseline diets vary greatly, but generally were unhealthy with low amounts of fruits and vegetables and high amounts of refined sugar compared with both catered diets. So, although the improvement was unexpected on the improved standard American diet, given the high fat content and meat consumption, it may be due to either the increased fiber intake or the decrease in refined sugar. Either way, this study provides reassurance that patients with mild or inactive ulcerative colitis can consume a diet that is high in fiber and healthy fats and still feel okay. So implications for patient care. Dietary interventions likely do benefit patients with mild UC or UC intermission. So it's important to include a discussion of diet with your patients and involve an RD knowledgeable in IBD. Thank you for taking the time to listen to this presentation today.